we provide the dignity by understanding that they are as human as we are. They are going through the situation of their illness at this time, the decline that they're going through, and we understand that it could be us one day, and so we value that person, we value their life, we serve them with love, with care, and we have a genuine heart for serving others, and I think that one of the reasons why we're able to provide that love and that kindness and that respect that they deserve is because out of our heart, we are truly genuine about what we feel for others, and our hope is that we're there to serve their needs. So when we show up at a patient's home, we lovingly and genuinely support them and understand where they're coming from, and we never try to force anything on them. We just try to make sure that they know that they are loved, and we're there to provide that support. And the respect is absolutely there every step of the way. We respect our patients, and we are there not to criticize, we are there not to judge, we are there to understand them in their moment that they're going through, and the family together along with them. For patients that don't have faith, don't have a religion, and sometimes, believe it or not, don't even have family to support them, and they're pretty much hopeless or they feel helpless, that's where we come in as a team. We come in as a spiritual counselor team where we understand the stages of grief. We understand that people are going to go through anger, they're going to go through negotiation, they're going to go through moments of despair, depression. There's different stages of grief, and so even though we have patients that are not necessarily spiritual or religious, or if they don't have family and they're pretty much going to die alone, to us, a patient that is alone, a patient that has no level of support is actually kind of helpless or feels helpless just by being trained and understanding the stages of grief, the normal stages of grief that patient is going to go through, and understanding them and not judging them and helping them understand that it's perfectly normal to feel the way they are feeling, and understanding that and providing the resource to them. It may not be spiritual, but just holding their hand and just listening to them, just making them know that they are important, and not judging them by the expressions and the things that they may say, but being there to understand them and giving them the right words of counsel, of support, and affirmation. That goes a long way with somebody that doesn't have a family member, that doesn't have a God that they've ever believed in, and just showing them true, genuine love and just being there for them. Sometimes we could just do it by being there without saying much, just being there for them. And by holding their hand and being at their side, that goes a long way. Hardest part of being a spiritual counselor is being there for a family that is in great need, especially when the hospice patient is very young. When the hospice patient, it's difficult for us because we could identify ourselves with that patient. It could be us on that bed. It could be us that's going through that illness. So it's very difficult seeing young kids and children having to see their brother or their father or their mother that are so young leaving us. And so thank God that we are there, we have been there, and God has given us the experience to walk with them, to hold them, and to make sure that we have the right words, and we tried everything we can to provide support through them. But it's difficult, it's painful, but somebody has to do it, and we are there for them. So yeah, it's the hardest part, seeing a young patient that is slowly going away. It's hard, but we are there to be a support to the family. And once we let ourselves concentrate on the family and concentrate on those little ones that are staying behind, even if it's difficult, we provide the resources and we provide everything that we can to make sure that the family is in good hands. So So no matter how difficult it is and no matter how painful it is, we're there to provide that support for them.